labor takes time. Contractions, active labor takes time to kind of really set up. And then once you're in active labor, say 5-6 centimeters, then you're still going to take some hours before you get to 10 centimeters, assuming you're progressing. And then you have to push for some hours. But for some people, the bag of water will break before labor starts. It's usually a pretty small percentage. If I remember correctly, it's about less than 20% of people's bag of water will break first. Nonetheless, this video is about breaking the bag of water and what happens thereafter. Hi, it's me, Dr. Wendy, aka Dr. Every Woman, and as always, we are here to break down issues, medical mysteries, talk through common concerns and maybe some uncommon concerns, and take off the Today, I want to talk about what happens when your bag of water breaks and you're not in labor. So first things first, most people who go into labor will labor first and their bag of water will break along the way. So they will be laboring and laboring, the uterus will be contracting, and there's tension and pressure put on this bag of water, also known as the amniotic sac. The amniotic sac is covered with an amnion or a membrane. If you've ever cleaned chicken, it's kind of similar to that like kind of slippery, thin membrane that you can kind of tear apart. That is the bag of water that the baby is in. And so it's kind of like a water balloon, but easier to break if needed. And so when the uterus is contracting and the cervix is opening, it kind of creates an environment where the pressure allows the bag of water to eventually break. But for some people, the bag of water will break before labor starts. It's usually a pretty small percentage. If I remember correctly, it's about less than 20% of people's bag of water will break first. And then a lot of times as the fluid is coming out, which it will continue to come out until the baby comes out, labor will ensue along the way. So labor will start as the fluid is coming out. If it doesn't, that can present a problem. So what happens is inside of the uterus is what we call sterile. So there's no bacteria inside of the uterus. It's an environment that has no exposure to bacteria because there just hasn't been any access there. And even like babies pee and poop, like meconium and stuff, is sterile. There's no bacteria there. It's excrement, but it's not dirty like ours. The reason why meconium is bad for babies is because it can be really irritating to the lungs, and it also can symbolize or signify that baby could be in distress, but it's not because it's actually like dirty like our stool. Now the vagina is teeming with bacteria, and it's supposed to, like, that's normal. It's not dirty. It's just a bacteria space, and that's what keeps the balance in there. I call it an ecosystem because it's like a jungle in there, and it's supposed to be. So the bacteria that are inside of the vagina should not be inside of the uterus, but when the bag of water breaks, the communication starts there. And infection can come if that bacteria gets to set up shop inside of this uterus that's got all these nutrients and this environment that it loves. If that communication stays too long, that can lead to an infection. Now, ironically, sometimes infection is what causes the bag of water to break. So sometimes that is the reason the bag of water breaks, but a lot of times that's not the reason. So that said, usually when I know a person comes in who is term, so if you're preterm, it's different because if you're preterm, we actually might want to delay labor and delay delivery of the baby until baby is mature enough or until we get steroids on board for the lungs. And so we kind of take the chance of infection occurring and we try not to do exams and introduce any bacteria into the uterus, but that is like a different scenario. But if the person is term, we actually want to now get the uterus moving and evacuate this baby before any infection sets up for mom or baby. So if I have somebody come in and they're like, my bag of water breaks, I'm not in labor, I'm like, okay, let's put you in labor. Let's get some contractions going, usually with Pitocin or something that will help them to contract. And something is, I'm saying vaguely, because, you know, some people don't want Pitocin right away. They want to see if their body will kick in. And if they want that, if a person desires that, I will give them a few hours, generally speaking, up to about 6, give or take, for them to at least start having some painful contractions and like kind of be on the road to delivery. If they're still only contracting sporadically or nothing is painful, I'm like, we need to kind of nudge this along, because what we don't want is for an infection to set up. And now we're truly up against the clock to make sure that baby is safe and mom is safe and needing to deliver before you even had a chance to labor. Because keep in mind, labor takes time. Contractions, active labor takes time to kind of really set up. And then once you're in active labor, say 5-6 centimeters, then you're still going to take some hours before you get to 10 centimeters, assuming you're progressing. And then you have to push for some hours. Well, if there's an infection inside of the uterus, we can't wait for a person to, be 10 centimeters. And if they're at risk, like, that's not safe for them. So, but if we can get that process underway and help them continue to make that progress before they get an infection, that's ideal. Like, that's the goal. So it's like, you're kind of wanting to like be on the front end of getting the wheels in motion before problems could arise. And I hope if this is clear. Tell me if it's not in the comments. Tell me if I'm making no sense at all, or if you're just like, can you go back to this part? I will be happy to make a follow-up video to this. But like, you'll have some people who are like, well, I don't have an infection now, so can't you leave me alone? Well, yeah, but you still need hours to get through labor and delivery. If we wait until you have an infection, we don't have that time. We no longer can allow those hours to progress. So you have to like anticipate the problem in order to prevent the problem, if that makes any sense. Like, this is preventative care when it comes to pregnancy. If your bag of water breaks, we're trying to prevent complications by helping you go into labor. I want to do a separate video about Pitocin because it's a conversation in and of itself. And I think the internet is not kind to Pitocin, but Pitocin is oftentimes like the thing and the only thing that gets people to vaginal deliveries. And I know people are like, well, but it can cause C-section. Nah. Okay, I'm not going to get into that right now. Come back for that, or tell me in the comments if you want me to really unpack, like objectively unpack Pitocin, because I want to do it, but I only want to do it if you want me to. And I won't be super biased. I know I'm biased because I'm an OB-GYN, but I can tell you the pros and cons of Pitocin. Nonetheless, this video is about breaking the bag of water and what happens thereafter. So if you haven't gone into labor by yourself, you may need help nudging into labor. And if you don't get that help, and if labor doesn't start on its own, you actually may be increasing your risk for C-section. Because if you could develop an infection and then we cannot wait hours and hours and hours for you to get into 10 centimeters and to push, then you end up with a C-section. So just try to reframe those who are concerned about Pitocin or augmentation of labor, which is helping labor along. If your bag of water breaks first, we're actually trying to get you a vaginal delivery by helping you get into labor. And so then that's why too, when I'm inducing somebody, say I have to induce a person for a reason, or if it's not a reason the person wants to be induced. I don't really encourage people to be induced usually unless there's like circumstances around it. But if a person wants to be induced or I have a reason, I will wait to break their bag of water until they're like really in labor. Like, I'm not going to break it first because I am now creating this problem. I'm setting them up for a long time with their bag of water being broken. But if we can get like 3 centimeters, 4 centimeters, some contractions going, that's a good time to add in breaking the bag of water, because now the uterus is contracting on less fluid. So the volume of the uterus has gone down. So the contractile muscle can actually work harder. Like, think about if you're filled to capacity, you can't move, right? But if you let some of that fluid out, you can move more, and that can help the contractions be stronger and push the baby out. So I hope this was a little helpful when it comes to the conversation of what happens when the bag of water breaks first and why we need to augment or nudge along. And if a person, again, wants to wait a little bit of time, like a few hours, I'm not against that as long as baby looks good, as long as they're good. And baby looking good is important too. Like, if you're at home, I don't know what baby's doing when these contractions are hitting, and if there's less fluid, is the umbilical cord compressing? Is baby's heart rate doing well? Like, I want to make sure if we're waiting that we know baby is safe and mom is safe. So I encourage people when their bag of water breaks to come into the hospital. Even if we don't intervene, even if we don't do anything, I want to be watching you closely and making sure that you're safe. So let me know if it did or if it didn't, because I do like the encouragement if it did make sense. Let me know if you want to do a follow-up video or to really unpack any of these individual things. And again, I really try to be objective in some of these, well, in all of these videos, so that you can kind of understand both sides and trust that I'm not telling you things just because I want to do whatever. Like, somebody said the other day to me, like, they were afraid to go to this one hospital because they don't want to be rushed to delivery because somebody had to get to Christmas dinner. We don't do that. Like, I'm going to be at the hospital if I got to be at the hospital for you. I'm not going to rush you into anything that has to do with my comfort or my circumstance, but I am going to let you know what's real and what, risks and benefits are. So I hope this was helpful. Don't forget to like and subscribe. And as always, visit your friendly local gynecologist. Bye.